My name's Tony Castleberry. I was born and raised in Northridge, California, which is a suburb of Los Angeles. I went to medical school at the University of Pittsburgh in Pennsylvania, and I did my training in general surgery and cardiothoracic surgery at Duke University Medical Center in North Carolina. I was always enthralled and fascinated by the surgical disciplines, and really the ability to provide treatment and therapy in such a unique manner, a hands-on, technical way to have a direct impact on that patient's prognosis and in their disease or illness. It drew me to it from the very beginning. And what also struck me was just the scope of practice of a surgeon, to be able to meet patients in the clinic, outpatient workups, obviously the technical conduct of the operation, the post-operative management, complicated patients in the intensive care unit, the ability to maintain longer-term relationships, get to know patients and their families over a prolonged period of time and follow up. It really encompassed everything that I thought I wanted to be as a physician, just that whole scope of practice. As I progressed in my training and got exposure to a lot of different surgical specialties and surgical disciplines, what really struck me about cardiac surgery was how challenging and complicated and really elegant those operations are, the complicated physiology that goes into those patients, the disease processes that you're able to intervene on and treat, and really the opportunity to help people who have severe and sometimes life-threatening illnesses and to be able to really make a serious impact. I specialize in adult cardiac surgery, which in a broad sense encompasses diseases of the heart and the great vessels that arise from the heart. So that can be related to blockages in the arteries that supply the heart muscle, coronary artery disease. It can be related to diseases of the valves of the heart that can require either repair or replacement of those valves. There can be conditions that affect the squeeze of the heart muscle itself, and sometimes that can require a mechanical support device to help support the heart, or even in some situations, a transplant, as well as diseases of the great vessels that arise from the heart, the aorta and the pulmonary arteries. And so that would include things like aortic aneurysms, dissections or tear in the aorta, removal of blood clots from the pulmonary arteries. What really drew me to the University of Nebraska Medical Center and Nebraska medicine was the people, the team, the professionals, really the full scope of the organization of people that I met and had the chance to work with. And I think it's really what's fostered by an academic medical environment like this, the focus on creativity and innovation and research and being on the cutting edge of the forefront of medicine and changes in devices and technologies and therapies and treatments. And to be able to do that in a facility like this, an environment like this, where you're able to take care of the community as well as the broader region, as well as the opportunity to get involved on a national scale, and to be someplace in addition to the research components, you can get involved with medical students, make an impact on people early in their medical careers, teaching medical students and residents and fellows.